Good afternoon. Good to see all of you. You feel like you're so far away. I will say this, that if anybody feels like they want or need to move forward, you can. We're going to have a few members come in maybe on the first row, but if y'all feel like you're too far away, you are so welcome to spread out up here. Let me call to order our hearing for today for the Appropriations Human Resources Subcommittee. It's good to see each of you. Before we get started, how about if we offer a little prayer here just a moment? Please bow with me. Dear Heavenly Father, we gather here today to do your work. Please open our ears and our hearts to hear the concerns and the work of so many people here that affect lives and do all they can to make them better. In your name we pray, amen. So we are going to get started right off here with the Department of Human Services. Commissioner Candace Broach, please.
Good afternoon.
Good afternoon.
Sorry, is it working? Oh, good afternoon, okay. My name is Candace Broach, and I am Commissioner of the Georgia Department of Human Services, and honored to join everyone here today. My remarks will be super short, and I'll start off by highlighting the statewide adjustments for fiscal year 2024 and common changes across multiple program budgets for our agency. So, first, we want to thank the governor for recommending a $2,000 cost of living increase for our full-time benefit-eligible state employees, which will help us retain quality talent and recruit new employees. The governor has also included funding to accompany this increase, including adjustments for insurance premiums, merit system assessments, and TeamWorks billings. And across several program budgets, you'll see FMAP adjustments to reflect recent changes at the federal level. And we remained deeply appreciative of both the governor's and the General Assembly's historic investments in our workforce, and we respectfully request your continued support of these initiatives, especially for our frontline staff who work tirelessly to protect vulnerable children, advocate for the elderly, and care for families in need. This increase makes the most dramatic positive impact on their lives. And we can see these dollars at work. For example, in our most recent human resources reports, turnover is trending 2.2% lower for our child welfare caseworkers than January 2022, and the same is true for their supervisors, with attrition 8.4% lower than the same time 1 year ago. Also, turnover is 5.4% lower today compared to last January for our economic support specialists who process applications and renewals for Medicaid, SNAP, TANF, utility bill assistance, and more. These numbers for our agency are incredibly encouraging, and we continue to aggressively recruit new talent, more efficiently onboard staff, and consider creative strategies to retain our best employees. Now, using the House's tracking sheet, going to child abuse and neglect prevention on line 28.2.4, the governor has recommended $184,926 to reflect marriage and divorce filing fee collections as authorized by state law for the Children's Trust Fund. Then turning to federal eligibility benefit services, line 28.11.5, the governor has recommended $3,224,889 for 300 additional Medicaid eligibility workers. And starting this April, the state must redetermine or recheck the Medicaid eligibility of roughly 2.6 to 2.7 million Georgians across 14 total months, as required by recent changes in federal law. So these additional eligibility workers will allow us to better handle higher monthly caseloads as we work through the Medicaid unwinding process. To prepare for such a historic undertaking, and by working closely with our sister health agencies, we're on track to hire hundreds of new workers. I've just heard today, I think we've received close to 2,000 applications just in the past few weeks that we're quickly screening, with hundreds of interviews in the works. And we've also streamlined training for more efficient onboarding. We've cross-trained our existing staff. We've deployed better technology to automate or better process our casework. We've delivered self-serve kiosks to 411, or we're in the process of delivering self-serve kiosks to 411 libraries across Georgia for families who may need it, especially with the extra hours that are available at these libraries to self-serve their applications and renewals. And we've launched a statewide public awareness campaign for Medicaid unwinding, which has resulted in more of our constituents opting into electronic communications. So that'll be a good savings in postage. It's also just better dialogue with our customers in real time. And again, we would humbly request your support of the governor's recommendation in this program budget, which will be critical to our success and prevent unnecessary churn for Georgians currently receiving Medicaid. And that concludes my remarks, so I'm happy to take any questions.
Are there any questions from committee members? Right, Representative Donahue, let me see.
I can speak pretty loud. It doesn't work.
Is there a microphone there at all, down there? Okay. We'll see. Try it.
There you go. Thank you for what you're bringing to us, but about a month ago, you brought up staying in hotels for $1,500. That flashes in front of me every time I go by a hotel. Tell me the breakdown of the cost, how we can run $1,500 per night. And I really appreciate that, but I'd like
Sure. So that's the average, and so of course it can be lower or higher depending on the child. Generally, if it's a higher needs child, it's going to include the hotel room cost. It'll cover transportation. It'll cover their meals while they're there. It can cover property damage that occurs, which is not uncommon for certain youth that are staying in a hotel setting temporarily. And probably the biggest cost of that is going to be the contracted behavior aides. If we don't have staff who are staying there with them 24/7, they still require supervision, so we pay out hourly rates to those behavior aid agencies, and sometimes it requires having more than one person. So that's probably the biggest cost driver of the overall average $1,500 per night.
Okay, and with that, basically, they're destroying some of the rooms, basically what's happening also.
Unfortunately, if you have a child that's in crisis, then it can result in damage to the room, to the hotel lobby. That's not uncommon either. You have lamps and things like that in the room. There can be extensive damage.
Are there any other questions? Representative Oliver.
What items in your budget offer solutions for the hotel children or the prevention of hotel children?
So in our base budget we had an addition of roughly, was it $6.7 million that would remain in our base budget that gave us more flexibility to deal with hoteling, to actually be able to use those funds for a better placement for the child. So just trying to divert placements from a hotel or office setting. Generally speaking, the out-of-home care program budget is where we cover placements, and so to the extent possible, we're trying to prevent hoteling, and we're just working directly with our providers, sometimes even non-contracted providers, PRTFs, CSUs, higher needs group home settings, substance abuse residential treatment facilities, those kinds of places, so that we just negotiate a daily per diem, and that's the program budget where we do so.
I understood the $5 million that went into the recent budget cycle discussions was all for directly hoteling. That was not for alternative placements. Am I right or wrong about that?
My understanding, based on discussions with appropriations staff and also just talking with the chairman, is that we could use those funds flexibly, and ideally it would not be for hoteling.
And all of the placements that you mentioned just now that you're looking at to offer a placement other than hoteling, those are ones that are already existing. There are no new placement options, but you are paying them more on individual negotiations. Is that what's accurate? Am I accurate about that?
Generally speaking, the negotiated rates on a case-by-case basis with those providers is going to be lower than what we would have ended up spending in a hoteled situation. In terms of trying to find new placements, one initiative that the state, I think multiple state agencies should probably endeavor to begin is the process to convert some of our group homes to QRTPs, or qualified residential treatment programs, which is contemplated under recent changes in federal law that would allow us to draw down more federal funds for longer-term congregate care settings if those group homes convert to a trauma-informed model with more healthcare staff available. Right now, the state does not have any QRTPs. It's a pretty extensive administrative process, but that would certainly be something that would be very beneficial for Georgia's children in foster care.
That's one of the ideas that's come to us in the mental health issues developing a new bill, is that exact new federal authorization, new federal money. So I want to ask you where you are on that particular option, and also ask you what happened to therapeutic foster care, and is that another new option? I'm looking for solutions.
I see. So to tackle therapeutic foster care first, my understanding is that so our agency worked with DCH to try to craft that proposal. When it was, I think, informally submitted to CMS at the federal level, it's not that they were displeased with the suggestion or the proposal, but they wanted to make sure that it was more comprehensive. It didn't just cover children in foster care. So that, my understanding, is why DCH has pursued more approval for behavioral health aids and similar services, which I think is still pending at this point. For QRTPs, the state has not started the process. I think it requires if I understand it correctly, because it can be complicated, is that we would need the state Medicaid agency to work with us to go and look at the facilities that would be eligible, those child caring institutions, and depending on the number of beds that they have, conduct a review as to whether they would fall under the federal definition for IMD, and then case by case decide whether there's an applicable exclusion for it so that they could then start the process of converting.
I'm interested in, as we move forward, if you could give me any follow-up on those two options that perhaps offer solutions. I agree with you that they have some complications to them, but I also think that they do possibly represent some solutions.
We agree.
And all of it would be less than $1,500 a day.
We agree. We'll definitely do that.
Thank you.
Are there any other questions from the committee? Then let me ask you just a couple. So the money included in the proposed budget for the $2,000 COLA, does that adequately fund all of your employees and agency?
Yes, ma'am. That's my understanding.
Fill out all the positions. What right now are any vacancies that y'all have?
In my dual role as DFACS director and DHS commissioner, the agency is operating more as one department, but there are still certain parts of it that are separate and distinct. So for the DFACS workforce, which is both the child welfare side and then the federal eligibility side, they're using a different system than what the rest of the agency uses. And in that system, what we're trying to parse out is what are the unfunded vacancies, which we don't yet know. It's a very tedious process, but we are going through that to try to get that concrete number. And so I can tell you that for I can give you our overall head count. I can sort of give you an idea by job classification, what the vacancies are, but and I can give this to you directly so you can look at it. But for the DFAC side, if you see vacancies, just know that the number is likely higher than the actual funded vacancy amount, and that's why we're trying to discern what the difference is in our record keeping.
Overall, DHS, what kind of shortfall are you finding in human, in your workforce?
Just one second, let me pull. So let me go through. Overall, the agency as a whole, as of January 31st, we have total positions as 12,510 with 4,034 vacant. Now, for that number, again, that number would account for unbudgeted DFAC specific vacancies. So, for example, looking at child welfare. So social services specialists, those frontline child welfare caseworkers, the total positions at the end of January was 2,621, an average head count of 1,530, and on the books it says 1,095 total vacant, but we don't know what the unbudgeted or unfunded vacancies are. We just know that it's a lower number, which is, I'm sorry that we cannot give it more concrete. It's just the nature of the system that we're operating under, and we're also trying to work with the state accounting offices. They look at technology to replace some of these personnel management systems, so we'll convert then.
So if there's any way to get any more of those numbers for us to look at, that would be great, just for us to see, what y'all are showing. Yeah, that'd be great. Would like to get that. So what is the turnover rate right now? Because I know there have been times when it's been really high, and you don't have to be specific, just even kind of a feeling for what it might be.
The overall, for the agency as a whole, the FY23 to date turnover rate is 14.6%, and the same time last year was 17.5%. Whereas in FY21, it was 8.3%.
Okay. So you're moving in the right direction, and that's good.
We can feel it too, just from applications alone. We can tell that the tide seems to be turning.
Good. That's good. That's good news. So are there any capital needs right now that are not funded? And if you need to break it out between the two, that's fine too.
Offhand, I don't think so. I mean, we're very pleased with the governor's recommendations, and we're immensely grateful for the additional add in our amended budget. And so for now, I think that we're in a good position.
Okay. And do you collect any fees that cover operations of the department that we don't appropriate? Are there other fees included?
I'm not aware of any offhand. I don't think that we do.
Okay. That's good. And just kind of for my information, have y'all moved?
We're slowly moving.
Okay.
We're slowly moving. We had 14 floors in 2 Peachtree. Well, we still have them technically to the close of this fiscal year. And then we'll complete the move to 47 Trinity in the same building as GTA with the effective date July 1st. So we're actively moving right now, but technically operating in both spaces.
Okay. Well, good. Well, we're pulling for y'all to get moved and be more accessible and just more of a lot of things.
Yeah, thank you.
So thank you. Thank you so much. I don't see any other questions at this point. If we have any, we'll get back to you on them, but appreciate the work you're doing.
Thank you.
So next, the Council on Aging, Deborah Stokes and Dr. Adrian Mims, I believe. And I will remind y'all there is a sign-up sheet for anyone that came in late right here if you'd like to make comment after we have the Council on Aging and then GVRA, and then we'll open it up for public comment.
Good afternoon. Thank you, Chair Lady Dempsey and distinguished committee members. My name is Deborah Stokes, and I'm Executive Director of the Georgia Council on Aging. It's a very beneficial job to have because the council is so well known and has a storied history of advocating for the seniors across the state in a very dynamic and effective and responsible way. The council is made up of 20 members who are appointed by the governor, the lieutenant governor, the speaker of the House, and the commissioner of the Department of Human Services. Those 20 members are citizen volunteers. And as a staff, we, myself, Nikayla Frederick, and Patrice Parker support the efforts of that council. We're very honored to be here today. We're asking for a perennial amount of $10 million for our home and community-based services. We are hoping that will be given much consideration, and I think that Dr. Mims will be convincing in terms of explaining the need, as well as many of our advocacy partners who can explain the need for that funding. But I do want to say, I was hoping that there would be a lot of attorneys in here. The council was established in 1977. This is the language. The council shall operate under the provisions of Title 49 Social Services, Chapter 6, Services for the Aging, Article 2, Council on Georgia, OCGA 49620 of the Georgia Code. The attorneys in here would appreciate that. They just love that sort of language, and that is how we came to be. So I thought I never talk about that, so I thought I'd give them a little bit of play today. I'm not going to take a whole lot of your time. Our 20 council members, we have 3 of them here today, including Dr. Mims, but I'm going to give you a good introduction on Dr. Mims. I would like to just say she's fabulous, she's wonderful, she's fantastic, but I don't think that's quite appropriate for a hearing. So I'll give you some details on who she is. Dr. Adrienne Mims is a physician who is board certified in both family medicine and geriatrics. She's nationally known expert in quality measurement and improvement, patient education, and geriatrics. After completing medical school at Stanford University, she completed her family medicine residency at the Charles Drew University and geriatric fellowship at the UCLA VA multi-campus program. Dr. Mims moved to Atlanta in 1990, where she has had an active clinical practice at Kaiser Permanente in Southwest Atlanta. There, she created a geriatric assessment clinic and home care program. For 10 years, she served as the Chief of Prevention and Health Promotion. During that time, she facilitated a committee on all of the medical insurance companies in Georgia to adopt a uniform set of preventative care guidelines. Governor Barnes sponsored a poster of the guidelines and had them distributed to all primary care physicians statewide. Dr. Mims served as the founding medical director of the Georgia Medicaid Management Program, providing care management and disease management to 250,000 aged, blind, and disabled Medicaid recipients. Recently, Dr. Mims spent 10 years providing clinical leadership for Medicare quality improvements for Georgia as the Vice President and Chief Medical Officer at Alliant Health Solutions. During that tenure, she was a founding member of the Georgia Physician Order for Life-Sustaining Treatment, POLST, Advisory Board, leading efforts for the passage of legislation and development of regulations for implementation of POLST. She is also a founding member of the Georgia Alzheimer's and Related Dementia Task Force. And in addition to that, she's our current vice chair of the Georgia Council on Aging. Governor Nathan Deal appointed Dr. Mims to serve on the Georgia Older Adult Cabinet that was instrumental in spearheading the development of the statewide database for social services used by area agencies on aging. Governor Deal later appointed Dr. Mims to the Council on Aging, and she currently serves as the vice chair, and she's been reappointed by Governor Kemp. She's an active member of many organized medicine organizations on the state and national level, including the National Association, the Medical Association of Georgia, the Georgia Academy of Family Physicians, and the National American Geriatric Society. I could go on, but I would like for Dr. Mims to come and speak to you and give you all the information that you need to know why we need $10 million for HCBS funding. Thank you.
Good afternoon, and thank you, Madam Chairwoman, and the rest of the chairpersons for being here today. And I appreciate the opportunity to speak with you and explain why we have this need in Georgia to support our seniors. I am Adrienne Mims, the Vice Chair of the Georgia Council on Aging. I am a Georgia licensed and practicing physician in family medicine and geriatrics. The Georgia Council on Aging coordinates a 1,000-member-plus aging coalition called COAGE, or the Coalition for Advocates for the Elderly. The active members of COAGE each year vote on priorities, and their list of priorities in 2023 immediately decided to include the $10 million additional funds for home and community-based services. This has become one of our perennial resolutions. But I took this forward to the Medical Association of Georgia and the Georgia Academy of Family Physicians to their 2022 House of Delegates and explained to them why this was needed. And those were unanimously adopted, and they're there to support us in this request. For the 2023 budget, we're very happy that we were able to get $4 million, and we're very grateful for that. The request was still $10 million. For fiscal year 2024, our COAGE budget priority is $10 million to support home and community-based services, the non-Medicaid ones. It's really urgently needed at this time because after the pandemic, the wait lists of people have significantly swelled. These are essential services that help seniors remain at home as opposed to going into more costly institutional setting, spending down their resources and going on Medicaid. So the problem is, since the start of the pandemic, thousands of people have been reaching out and joining, being screened by the AAAs and getting on the wait list for these services. Also, there's been a rising cost of gas and cost of food that has really impacted seniors. These in-home community-based services will help support them stay in the home. And the average cost that we would spend is about $2,000 a year, which is far less than paying for a Medicaid bed in the nursing home. So what would this legislation do? Well, the non-Medicaid home and community-based services really promote health and independence for our seniors and supports the caregivers. It has been consistently demonstrated that the resources spent in home and community-based services help Georgia elderly stay in home, and it helps them from being placed in an institution on average 51 months. They get to stay at home as opposed to being institutionalized. You can appreciate that. What are these in-home services? Home-delivered meals, adult daycare, respite, home modifications, and others. But the longer a person stays independent in their home, the less tax dollars are being spent on institutionalization. This money would keep older adults in their home, and it would also have the benefit of maintaining service providers that provide these home and community-based services in their community, so it's employed people. It supports the family caregivers, and it leverages these public-private partnerships for solutions that make a difference in expanding the resources for these patients in need, these people in need. Each year, our committee has sounded this alarm. Ooh, we're going to double the senior population by 2030. Yes, but because of the pandemic, many people reached out in advance of that and started asking for resources. So we anticipated that this need would be in 2030, but our client growth has been tremendous because of the pandemic, and they're seeking out more services. There's been an increase in the ability to screen and doing more additional screening by the ADRCs, Aging and Disability Resource Centers, so people are qualifying for it, but unfortunately, they're being placed on a wait list. Meals on Wheels and similar programs are designed to combat hunger among elderly, and it's one of the most visible demonstrations that people have heard of when we think about home and community-based services. So they provide this essential and many other services for the aging individual, but this also supports family caregivers. So family caregivers, sometimes called informal caregivers, are those unpaid individuals that assist with these activities of daily living and medical tasks. Those tasks are shopping, food preparation, housekeeping, laundry, transportation, giving medications, feeding, dressing, grooming, assistance with bathing, coordinating physician visits, managing financial matters, just to name a few. People who are caregivers, your daughters, spouses, partners, family members, friends, neighbors. 1 in every 5 adults in Georgia is a caregiver. 1 in 7 expect to be a caregiver within the next 2 years. These resources support those caregivers. Only 26% of caregivers are over the age of 65. The rest are working age adults. 59% of them are women. A third of the caregivers provide more than 20 hours each week of services. The role of caregiving really does take its toll, though. 47% go in late for work or call out. 13% went to part-time. 5% gave up working altogether. 4% retired early. This is during the age range when they should be paying forward for their retirement. So adequate funding of non-Medicaid home and community-based services will allow caregivers to be more efficient in their role and stay employed more actively. Another critical service of home and community-based services is caregiver respite. The Southwest Georgia Council on Aging just announced that they have brought back caregiver support groups. And this is a platform for the caregivers to share their experiences with one another, to receive information and services, and connect with others who are facing those similar challenges. The local area agencies on aging and aging and disability resource centers, they've seen an increased number of calls. Maybe the clinicians are referring more, maybe the community-based organizations are referring more, but the real need is that there are more people calling, being screened appropriately with the technology, but they're being placed on wait lists. Our wait list currently is about 9,600 people. And we think it's climbing. Can you imagine when they call and being told, oh, I see you need a ride to the doctor this week. I'm sorry, maybe in a couple of months we can do that. I understand that you're hungry. I'm sorry, we can't set up rates of services for people to bring those meals in your community at this time. We can do better than this. Much of the federal relief funding from the American Rescue Plan Act expires in 2024, and it helped to shore up the program some based on what our prior needs were. But they didn't anticipate this large growth that we've seen since the start of the pandemic. And as we're speaking to the AAAs across the state, we're hearing them say that they're having 300 and 400 new clients all over the state. Those new clients will remain on their roll. And if you're on the wait list, that means you may not get services for more than a year, or not at all. But this new client base, we must consider from now into the future. They came early on our doorsteps. We expected them in 2030. We have them now, and they'll be with us going forward. So we must true up the budget to support them. If we put in $10 million, it will cut that wait list in half. In half. An additional $10 million will cut that wait list in half. Fewer people going hungry and unable to meet their needs. More caregivers being able to stay at work and be supported. The harsh reality is that the aging network is working not only to struggle to meet these demands lingering from the pandemic, but now this current client base has more needs and more different needs than had been previously expected. So we urge you to support your older adults and their caregivers by adding $10 million to home and community-based services. Thank you.
Thank you, Dr. Mills. Thank you for telling us your story. That's great. Good, good. Are there any questions or comments from the committee?
Yes.
I remember in the past that we have been given a wait list for Meals on Wheels and a separate wait list for home health aid. Could you get us that? I'm curious how that breaks down.
Okay, you asked for a wait list that separates Meals on Wheels from the rest of them.
Yes.
Okay.
And how much is funding today Meals on Wheels, and how much is funding today Community Health?
Okay. And is that funding based on the Georgia budget that you're interested in, or any additional funds that came from ARPA that's going to go away?
I'm not considering ARPA that's
Okay.
going away. It's just the annual budget for Meals on Wheels and the annual budget for home health, which I think, if I remember correctly, could be wrong, is separately budgeted.
We can provide that.
Thank you.
Yeah, thank you. I was just going to tell you, I used to be a caregiver for my mother while I worked in the health insurance industry for about 20 years. And trying to balance the two is almost impossible. I mean, you're looking at your job and then trying to come home and do that and take care of the doctors and do those. It's a good program. It's well worth. So thank you.
Thank you.
Thank you. Any other comments? Okay, Terry, maybe can we move that microphone toward?
The mic. Thank you. Thank you so much for this information. This is very helpful. And I was just wondering if, and I'm sure this data is out there, but if you happen to have any numbers on the dollar amount that these family caregivers save the state of Georgia every year.
They're unfunded, and
Right.
I can get that information for you. We do know national numbers and can give an estimate. Thank you.
Thank you.
Thank you. Any other comments or questions? Not seeing any, so let me just ask you, are you seeing a decrease in the caregiving population at all?
Yes.
The challenges of workforce?
Well, it's happening for two reasons. We were of the generation where there were multiple children for every adult. We have now gotten into the generation where there's many fewer children per adult, so it's fewer caregivers. Those caregivers are not just living in the community or next door, they're living across the country. And so the volume of people who are these unpaid caregivers who were family members has dramatically decreased, and the stress on them has increased.
Okay. Are there any other fees that y'all collect beyond what we add into the appropriations through the budget? Do we know of any
We don't collect fees.
fees specifically that come from the population you serve?
From the populations we serve?
Mm-hmm.
No, ma'am. These
Okay.
are non-Medicaid.
Good. Right. We're just checking on that, just to make sure that we have that clear. Let me see if there's anything else here before. I think that's it. So if we have any other questions, I know we know how to get in touch with you, and thank you for the work that y'all are doing. It is powerfully important to care for each and every person as they get a little bit older, and to try our best to keep them in their homes, and I know that is your main goal. And I so appreciate also the priorities, the way your organization does that to allow those who are being served to come together and decide what they feel the pertinent priorities are. So thank you. Thank you for the work you're doing.
Thank you very much.
Okay, and now, let me see, we do have, I'm going to get the list down here just to make sure. I want to remind all of you that there is a list to sign up if anybody hasn't. And we will move toward Georgia Vocational Rehabilitation Agency right now to hear their update. So Director Chris Wells.
Good afternoon. I'm Chris Wells. I'm Executive Director for the Georgia Vocational Rehabilitation Agency. Just wanted to start off by saying Happy Valentine's Day. Hopefully I got everything right this year, and you guys will be able to see me tomorrow if I did everything okay at home. First, I wanted to start off just thanking the subcommittee, as well as the governor's office, on some of the things that we've been able to accomplish over the last couple years here at GVRA. The support that we've received and the ability to be able to make a couple adjustments has really been an exciting time. And the things that we've put in place, I feel like is going to be able to help the agency move forward. So I just wanted to thank the committee, thank the support, and also thank the governor's office for the recommendations and the support that they've provided as well. Of course, GVRA is a 5 budgeted program. Our biggest agency or biggest program is Vocational Rehabilitation Services. And part of Rehabilitation Services is our residential program. Part of the presentation, you'll see a big request in bonds to help support our residential facilities. So we wanted to make sure that we highlighted the support that our residential program provides. Our next slide is just a summary, again, of our 3 other programs, with Disability Adjudication Services being one of the programs that is 100% supported by our federal partners, but it's a partnership for disability determinations as well as SSI determinations. Our next presentation, because we're administratively attached to the Department of Human Services, just provides a little bit more of a consolidated view of what our budget looks like, along with our expenses for FY 2023. You'll note, again, the two largest programs is the Disability Adjudication Services programs, which is our SSA partnership. We're seeing a lot of requests for claims. Right now, we're averaging about 225 days to get those claims through. So we have been working very closely with our partners at the federal level to try to figure out how can we be a little bit quicker in terms of getting those claims out. Our largest program, again, is VR, Vocational Rehabilitation, and that includes our residential services program. You will see there in our other category, the 304-579 is a little bit of our cost allocation funds that are coming in from our support programs in order to serve the back office duties. And then that $5.1 million or so in VR, that's other funds, but the majority of that, which is approximately $3.84 million, we're part of what we call an employee network. And so anytime we work with an individual that may be receiving Social Security, if we get them employed, the actual SSA provides us with a return on investment, or if someone is receiving $500 in benefits, they get a job, and now they're making $300. As an incentive, the federal government provides us with some funding to be able to help with that. And so that's the bulk of that. We do have some other funds in there associated with our residential program for fees when individuals come and stay overnight. We charge a fee for them to stay in their dorms. Our next slide is pretty much the meat and potatoes of the agency. This is our budget recommendations for FY 2024. The only real change that we have in our operating budget, if you turn to page 7 of 9 of your document, is 28.24.5, and that's basically a reduction of funds for the Georgia Commission for the Deaf and Hard of Hearing. We received this last year in order to assist with some operating and outreach. The previous 4 recommendations is a summation of the statewide changes that you'll see throughout every agency's budget. The 2,000 is the amount of 993, and that's broken up into the programs. The reduction there related to our risk billings with DOAS of 140,000 in total. Our TeamWorks billings of 206, and that's basically an adjustment there associated with how much we use our financial system itself. And then the reduction of 6,354 is associated with our merit system assessment billings. Our next 24 recommendation is related to our bonds. And so in our FY 2024 bond, the governor has recommended a little bit over $7.8 million. And you'll see here a picture is worth 1,000 words, but we're looking for a major maintenance, renovation, and repairs in Meriwether County of Roosevelt Warm Springs. Representative Oliver, I think last year we talked about how we're going to change how we do business. And it was a big presentation, and I don't think we were clear in terms of what we were trying to do. But essentially what we're trying to do is expand our services, and how we expand our services by, again, leveraging technology, streamlining. And one of the things that we talked about in that particular process is investing in our residential program so we can serve more individuals. We have approximately 150 beds that we're serving, but we have a large operation. And so we talked about last year about looking at a comprehensive needs assessment to be able to determine what are the needs instead of coming out and asking for that particular funding. So what we did is we worked with our partners at Georgia at GISFIC and GBA, and we actually work with a company that specializes in campus master planning and assessments. And one of the things that came back is we got them to look at the 13 buildings that we use most frequently, and basically came back about $62 million in some maintenance, repairs, and some funding there. And so the slide that you see here is basically some of what that $7.8 million is going to go towards fixing. We approximately, so the pictures that you see here is the quadrangle, and so that 7.8 is kind of designed to go in and what we call do waterproofing. So the issue is water gets into everything, and so over time as that water gets in, it seeps in, and it starts to work at the infrastructure of buildings. And so what we're trying to do is basically do a building envelope and that building envelope basically goes in, seals the facility, seals the infrastructure, changes out a lot of the things that could be contributing to what we call leaks. And then once we get that envelope addressed, that gives us the opportunity to bring a lot of our rooms back online. The two pictures, the one in the middle and the one to the right, these were previously used to serve students for individuals that were coming in. And if we were to get crests and builders moving in the right direction, again, we have 150 beds or so. That gives us the opportunity to bring on about 75 beds. It doesn't seem like much, but with the changes that we've made over time, we think that that's going to grow exponentially. So this gives an example of kind of where that 7.8 would go. And again, it focuses on growing and building capacity at our residential facility. Our next slide kind of goes into just a few of the conversations about why we're requesting and why we're looking at our capacity. This gives an example of, as we try to work and get into the school systems, as we try to work and increase our capacity, this slide basically shows that we spend about 26% of our operating or our federal funding on our residential facility at Roosevelt Warm Springs, but currently they only account for 2.5% of the population that we serve. And so we already have that infrastructure in place. We already have staffing in place. Whether we serve 1 or whether we serve 1,000, pretty much the footprint is going to remain the same. So instead of requesting, funding to expand services, we're trying to get our facilities online, and that in turn is going to help us because we have the infrastructure already in place to be able to serve. Our next slide is something else that we looked at, looking at just the cost per student. Again, the infrastructure is there, the staffing is there, the expenses are there, and so the more that we are expanding, it gives us the ability to serve more individuals, and these numbers over time will eventually start to come down where we're serving more. And again, this slide right here shows a little bit more of the cost per student based on our limited capacity, but the infrastructure that's there on campus. Our next slide, again, when we're requesting, we're always looking at ways to streamline. We're always looking at ways to build capacity and not only serve a portion of the population, but also serve 159 counties and over 180 school districts. So one of the things that we looked at is, again, the pandemic. You can look at it as a curse or you can look at it as a positive. We looked at it from a way that we learned quite a few things. Of course, I talk about leveraging our infrastructure. We talk about capacity. We talk about all these things, but we really had an opportunity over the last year or so is look at our residential operations. And one of the things that we realized is that we had 30 career paths. A lot of these career paths were very similar to what we offer at TCSG. And so what we said is, why offer or compete with TCSG when we can work with our clients to be able to move them to technical schools, since we have some of that infrastructure and we have 2 large providers that work with our CTI provider as well as our high school high-tech provider that works with students or individuals that would go towards our technical school route. So we went from 30 career paths down to 6. And how did we determine that 6? Those 6 career paths were typically career paths that we were already placing our students in. And so we decided to pursue credentials in those particular 6 career field paths. We went from a rolling admissions down to a semester system. Again, if it's not broke, don't fix it. The tech school uses the semester system. The high schools, colleges use this semester system, and it gets us online with parents or individuals that are dropping their students off to schools. This gets us back in line and consistent with what's the current route. We went from an 18-month wait list down to a no waiting list, and so the pandemic allowed us to reassess the students, reassess what we were doing, and we were able to look at and call students and parents and say maybe working with a provider is a better opportunity. Maybe going to tech school. We had quite a few of them that had wanted to pursue welding and were in tech school, and so we had to make the tough decision. Even though we want them to come to our residential facilities and we want to serve them, the goal and objective of GVRA is competitive integrated employment, and so we thought it'd be best to send them, let them have an opportunity to attend college or tech school, and if it doesn't work out, they can still come to GVRA and they can work with us to be able to provide those supports. We went from a 9th grade reading and math level down to a 4th grade based on the services that we provide in the career field. and we actually consolidated some of our back office functions to be able to reduce some of that overhead costs as well. So these were some of the adjustments that we have made in addition to looking at areas that we can improve in order to make sure that as we look at transforming what we do and how we're doing it, we're not only talking the talk, but we're also walking the walk as well. Our next slide, we're just going to go into some updates based on some of the requests that we received, as well as some of the appropriations from the last couple of years to be able to provide the committee with a little bit of an update. So our next slide is just basically provides like the total students or total individuals served compared to students served. And you can see there is that we've made a focus of serving more individuals. Outreach is one of the biggest things that we have to do a better job of. And so the best way of outreach is getting into the schools, letting parents and individuals know the services that we offer. So if later on in life, if individuals need those services, they've been attached, touched, or we've had an opportunity to work with them. And so at this particular point, we're serving more year in and year out. We're serving more individuals, specifically more students, and the data for FY 2023 is only 6 months in. And so it looks like we're going to be serving more this year than we did last year, and that tells us some of the things that we've put in place over the last couple of years is starting to work and it's starting to take off. Our next slide kind of shows the impact of some of the changes that we've made. And again, this slide shows our counselors. We talk about needing counselors, and I think Commissioner Brose kind of talked about some of the advantages there, but we all compete for counselors. We compete with our sister agencies, we compete with our school systems, and we compete with insurance companies. But you can see here is as we've made our adjustments and made our changes starting in FY 2021, we took some responsibilities away from our counselors to make the job a little bit easier and created what we call, like say, a counselor and a pre-employment transition specialist position. And that position started in 2021, basically allowed those individuals to go into the school. So they're going into school, they're teaching pre-ets, they're having those conversations, and they're moving the needle. So if you take those things into account and you look at the last 3 years, we are actually moving the needle on the number of counselors that we're hiring based on the changes that we've made, as well as taking a little bit of pressure and splitting that particular position. Do I believe we'll ever get back to 306 counselors? No, but I think leveraging technology, making the job a little bit more palatable, and listening to the needs of our individuals on the front line will make the job a little bit easier. And then our next slide probably gives a little bit more of a detail of what the $5,000 has done for us, and then the changes that we've made. One of the things you have to know where your bread is buttered. And basically, our bread is buttered at the counselor level. And so we focus tremendously on how to make that job attractive. This is just a snapshot of at least the 2 years I've been with the agency of what we've done. Is, again, Counselor 1, 27,000 coming in. This is with a master's degree. Now the median is 45,873. So this chart gives you a little bit of example that as we've streamlined, as we've looked at ways that we can do things better, as we've tried to really hone in what the governor has been recommending and preaching, that we've tried to take that as an opportunity to show that we're following in those particular footsteps. And instead of putting it in travel or putting it in the nice and fancy things, we've been putting it back on the front line in our counselor's pocket. And so you can see there as of right now, 45,873. And what that doesn't tell you is that we've expanded the scope of what our counselors are coming in. And so instead of having everyone with masters, we're also looking at individuals with bachelor's degrees and years of experience. And as you can see, the two bullets for FY 2022, FY 2023, you can see what that $5,000 has done. I mean, literally, we went from 23% as an agency down to 9.9%, and we went from 16.7% to 2.6%. Again, I would like to believe, because I'm the best agency head and everybody wants to work for me, contributed to that, but I must believe that part of it is the changes that we've made in terms of salary and some of the leveraging technology itself. And then our last slide just provides a really a holistic view of where the $2 million that the subcommittee put in the budget with approval with the General Assembly as well as the Governor's Office. And again, you've heard some of this, but the $2 million allowed us to really open up our referral portal, update our website. We didn't have much information on our website, and so we updated that to provide more information so individuals know where the resources are. We opened up priority categories. We did, again, in first time in 12 years, we have had provider rate increases. We've increased services and staffing. That has allowed us to fully fund some of our SEALs, Georgia Radio Network, and what we're doing right now in order to help us with services is we're piloting dedicated counselors. So right now we have Georgia Academy for the Blind that we're working closely with Dr. Gibson on, is we are piloting a project where we're putting counselors dedicated to various schools and various schools in rural areas, and they'll be assigned there, and that helps us also make sure that we're providing services to areas and places that we haven't consistently provided in the past, and we hope that that helps. And then lastly, agency partnerships. Currently, we're in the process of hiring 50 counselors, and again, I think Candace Gross mentioned, again, when I first came into the agency, we would have one open, maybe 2 individuals would apply. Now, I believe with the 50 counselor vacancies that are posted, we had well over 150 applicants for those particular positions. So it does allow us to be a little bit more selective, but we're going to do the best we can to hire all 50 and hire even more, because we're also looking at what Commissioner Kaylee Noggle, as well as Mr. Tanner is doing, and what the General Assembly may do with the 1115 waiver, as well as with DBHDD, where we have a partnership. So when we hire individuals, we're also looking at how we can be better partners with our bigger agencies that are looking for assistance or need our assistance when it comes down to competitive integrated employment. And again, we have the capacity. The changes that we've made is going to allow us, again, with the $2 million, to be able to hire these counselors, to be able to help our sister agencies with the 1115 waiver, as well as assisting our supported employment partners at DBHDD. This concludes our presentation. If you have any questions, I'll be more than happy to take them.
Representative Oliver.
Thank you. Are all your 150 residential rehab beds at Warm Springs?
Are they filled?
Are they all at Warm Springs? Are they scattered around the state?
So we have 150 at Roosevelt Warm Springs, and we have 40 at Cave Spring Center.
And the Warm Spring campus includes a hospital, and that's managed by the Regents. And what we're talking about, your 150 beds, is a separate, and that's your responsibility.
Yes, ma'am.
How many beds are filled today?
So right now we have 35 beds that are filled today. Because we're changing to a semester system, the students that we have right now is finishing their certifications under the previous model. Because we're aligning not only the entire residential facility with VR proper, there is some substantial training that we need to do. So over the next couple months, we're going to be doing some training, and then the summertime, what we're doing is we offer a program called GROW, and that GROW program is basically pre-eds. We go in, we do work-based learning, we do career counseling. So we're training that staff to be able to assist on that particular front, and then starting June 5th, we're making sure that, and we're trying to fill every single one of those beds for 1 week, what we call GROW camps. And so we're going to do that throughout the year.
The residential 150 beds are all the, guessing that they're designed for people who have physical disabilities that require them to have care 24 hours a day. Am I right or wrong about that?
No, ma'am. I think you're probably thinking about the hospital. So when we were one agent, or when the hospital and GVRA was one back prior to 2015, you had that model where individuals would come through the hospital. If they had a physical, they could easily be moved into basically a GVRA program or a VR program itself, because that has separated itself. Our beds are actually set up like a college campus. So if you were to walk on campus right now, they're accessible, but they're actually designed for individuals that may have a physical disability or they may not have a physical disability. So it's just like going to a college campus.
Then why aren't they outpatient somewhere else?
Ma'am?
Then why aren't they outpatient somewhere else closer to home?
So the campus itself is designed to give our clients the opportunity of a college campus. So initially, when Roosevelt Warm Springs and the process was set up, it was kind of set up as what you're describing itself. But over the years, GVRA has transformed with our federal funding from 2015 as a competitive integrated environment. And so during that transition, we actually offer what we call accredited programming and things like that. So what we do is individuals that may not be ready for college or individuals that may need some supports, they're able to come to Roosevelt Warm Springs. They can participate in welding, they can participate in hospitality, they can participate in any program that's going to help them be employed, but it just gives them a residential opportunity to be able to do that as if they would be sitting on a college campus.
Final question, if I may, Madam Chair. Are you going to renovate all 13 buildings, or have you decided to select ones strategically based on your program?
So basically that's what we're doing. It's strategic. The 7.8 is basically our highest use facility, which includes our auditorium for graduation. It includes our food service area, and it's basically the iconic Georgia portico. So it's the entry when you come in. That's where we do 90% of our services there. And so you're absolutely right. What we're trying to focus on over this next 10, 15 years, maybe long after I'm here, is develop those high use areas and specific to the students and what the student uses are.
Thank you.
Excellent question.
Are there any other questions from the committee? Not seeing any, but let me ask you a minute. So just a couple things I'll be clear on. So I believe Representative Oliver asked, and there was a total of 190 beds, is that right, with the 40 at Cave Spring and the 150?
Yes, ma'am. So about 190, 150, and 40.
And tell me again the number right now that are fully utilized.
So right now we only have 15 beds right now.
15 in use?
Yes, ma'am.
Okay. So that's a huge shortfall.
Yes, ma'am.
And basically, just to boil it down as to why so few are being used.
So yes, so if we were to go back to our changes, so we made a change related to how we're serving to get on a semester system. And so when we made these changes here, we took all of our remaining students that were rolling in and rolling out. We had to pick a stopping point to make sure we were able to serve every student that was on the waiting list to get them moving. And so what we want to do is essentially in March, when those students leave, it'll be training, getting prepared for the new model, which is GROW, getting individuals trained up on the VR process to be able to align their program with VR to make sure that we're in alignment with our federal partners as well. And then starting in January, we'll be back on that semester system, but in January what you'll see is where we're doing weekly camps starting in June, moving through to July, early August, and then I believe August 15th or so, we've aligned that to be able to say this is our first semester to be able to start. And so that's what we're doing right now.
Okay, is the goal to fill all 190 of those beds?
Yes, ma'am.
Still working toward that?
Yes, we are trying to fill. So we're working closely with our school system. One of the critiques that we received as we were looking at how do we do a better job serving our local schools is knowing when, with the rolling admissions, when beds would be available, understanding 2 years on a waiting list, understanding whether the individual that they refer to, when can we tell you that the individuals will be able to be served. And so after just hearing from our audience and having those listening sessions, we thought it would be best that let's get on a consistent schedule with our providers, with our principals, with our local school system to be able to serve individuals. So we're working with them right now to be able to make sure that they know what the new programs are, how do we serve individuals as we move forward.
So if you were projecting a date, not to reach that 190 capacity, but maybe a third or a half of that, are y'all kind of planning out with that to try to
Correct. So
reach those marks?
One of the positive things is that we were able to bring on a local hero. He's a principal, and I think that's the part that was missing, that relationship with our local schools to be able to understand what their needs are, because that's what we're trying to do. What are the needs? How do we get more individuals served? And so in working with our 8 districts and our 8 district managers, they're working with schools to let them know that we're available. So it is our hope that we can get, that those beds will be filled going into August. We have a list that we're developing right now, and I can get more information on that. And then at the latest, this time next year, if we're not 100% filled, we should be filled going into January of next year. So the want and the need for Roosevelt Warm Springs and Cave Springs to be available has always been there. We're trying to make sure that now, how do we take advantage of that want and need? Individuals know now that they can come in. All of our programs are 16 weeks long, so we had some discrepancies where some of them were 16, some of them were 32 weeks, some of them students were there for, sometimes 2 years. So all of our programs are 16 weeks long. We do have one set of programs, which is hospitality, that's recognized by Best Western, uses that particular program in order to hire their individuals and train up. And so the hope is, you're absolutely right, we're getting individuals in, we're getting them credentialed, and then we're getting them out. If they need to come back for GVRA services, they can do that. That is not a problem at all, but we at least want them to be able to come in, get that credential, go back in and work for us, figure out whether that works for them, and they may say this doesn't work for us, and they can come back. That's not a problem at all, but we wanted to make sure that we were providing services to as many as possible under that credentialed program.
And so just to make sure I understand, 190 total, and at both campuses, only 15.
Well, we have, I believe we have 5 at the Cave Springs campus itself, so yes, we're looking at close to 20 in total, yes.
So it's the 15 at Warm Springs plus 5 at Cave Springs?
About 13, and then about 5 at Cave Springs, yes, ma'am.
Okay. Well, we want you to fill those up as soon.
Oh, believe you me.
I know there are people that are anxious for that to happen. Also, to clarify one more thing, you said at one point it was 225 days till claims.
On our on disability, during COVID, SSA, this is the SSA side. So during COVID, the federal government essentially sent a lot of our staff, or allowed our staff to go home, and so we've been trying to catch up to be able to get that backlog. Because we can't make as many adjustments, we don't have as much control over that program. We have to run everything through our federal partners. So what we're doing right now is we're actually working with other states, because it's a national system that's being used, to be able to help process and get our claims. One of the advantages is that the federal government has released additional positions to allow us to hire. We even have to ask them for permission for positions itself, so we can't just go out and hire as we want. And so that's been slowing and bogging down our ability to be able to address some of the concerns on that particular side. But we've been, it's not just Georgia, it's other states as well that are seeing the same backlog of Social Security disability claim determinations.
Is it still 225 days average?
Yes, ma'am.
Yep, that's one we all need to work on as well. So, Representative Cameron.
Yeah, I was looking at the vocational requirements. Previously, you had a 9th grade reading and math level, and now we're down to the 4th grade. So basically what we were doing is, part of those 30 programs itself is we had programs that our students could not get in. So with those 30 programs, we would have one student in a program, or some of the programs wouldn't be viable. So what we tried to do is look at our population that we were serving and actually bring in programs that will allow our students to be successful in those particular programs. So we moved away from an entry of having that 9th grade reading level to what we were seeing consistently where our students were coming in. Because again, we had so many career paths, but we were seeing our students weren't able to actually enter into those career paths because they didn't have the prerequisite requirements to be able to enter those programs.
Goes in here, there. Okay. So, let me ask you also, so in the reduction of fees, why was the cut to the deaf and the hard of hearing commission made?
I'm not sure. We were just, it's a pass-through. Say it again, yes, it's a pass-through.
So we need to ask about that one. We'll see what we can find out. Okay, so you mentioned that there's some residential fees to stay.
Yes, ma'am.
in the dorms, right? How much is that?
So I think nightly it's 28, it could be $28 to $40. So typically we may see traveling nurses because individuals are working at AU, the hospital. And so we do have a few rooms that are available that if they're traveling in, we charge them just the cost to stay on the campus. One of the things with our federal funding, if we use certain types of federal funding specifically to do establishment or to grow or develop, that funding itself has to be used back in the program. And because Roosevelt Warm Springs, the part that those individuals were housed, are pretty much governed or was updated with federal funds, when we serve somebody that's not tied to the program itself, we have to make sure that we're using a different funding source. So instead of leveraging state funds, we charge the traveling nurses the amount that it would require to basically house them for a night.
Okay. So are there,
And student parents as well. So if student parents come in the area and they can't find a place to stay, if we have availability, we may charge them to stay overnight if they're traveling across the state or something.
like the same range of fees also?
Yes, ma'am.
Are there anything else that you collect fees for that cover operations that we don't appropriate? Is there anything else anything else that you charge fees for that are not from our appropriations?
No, I think for the most part, that is it.
Okay. What about the COLA, the $2,000 COLA? At this point, is that adequately funding all of the agency today?
So with Disability Adjudication Services, because that's a federal program, once it's signed, we send a letter up basically saying 2,000 is in there. They'll give us the cost of the COLA fully loaded with fringes. The other programs are fully funded. Right now, Georgia Industries for the Blind is functions off products and sales, and I believe the 2,000 is based on state-funded positions, and so they weren't eligible for the 2,000 because they're funded through products and sales.
Right. And as far as vacancies in your staffing, do you have an approximate number or percentage
Yes.
that you think?
So we have approximately 107 vacancies on the front line. That includes 79 counselors, 17 pre-employment transition specialists, and 11 VR supervisors. We typically, in our Disability Adjudication Services program, because we have to ask for permission for vacancies, every year that's a process where we have to request that. So we typically track it, but it's a phantom number itself. But if you were to ask how much do we need, we probably need another 50, 60, 70 adjudicators to be able to help us. And that conversation we normally have with the feds.
Right. Impacted by your turnover rate, I'm sure.
Say it again?
It's probably impacted right now by your turnover rate.
Yes, ma'am.
no doubt. Okay, well, I don't see any other questions at this point. If we have them, I know we'll get in touch with you. Thank you, and thanks for the work that you're doing.
Thank you.
We're looking forward to some of the things that you're laying the groundwork on right now, and I think some of the big steps that will be coming. So feel like even though we'll be gone, possibly, let's see if we can maybe get updates along the way.
We definitely will. We actually have a conversation with UGA on tomorrow to develop not just a 5-year plan, but pretty much like a local city. Let's look at a 50-year plan to see how we move forward. And so we think that that's going to also help keep the agency tethered on a consistent goal, consistent mission, like you said, long after you or I or anyone are in our particular role. So we're excited about that as well.
Oh, thank you so much. Good to see y'all.
Thank you.
So we are going to quickly call on Jody Stevens with Pace Center for Girls right now. I know y'all have a flight to catch too, so maybe you can tell us a little bit. A little bit. We want to hear. Good program.
All right, thank you so much. Good afternoon, Chair Dempsey and members of the committee. Thank you for giving us the honor of being here with you today. I'm Jody Stevens. I'm the Director of Government Affairs for PACE Center for Girls. I met many of you today and within the last few weeks, and I'm excited to speak with you about PACE as you begin to put together your budget. So first and foremost, I just want to say thank you for your investment in PACE last session. Because of the state's investment, we've been able to serve many girls here in Georgia. So I'm going to give a brief overview of our PACE program that we have here in Georgia, and then I'd actually like for you to hear from Rebecca Richard, our program manager here in Georgia, and Denasia, one of our lovely PACE Reach girls. So PACE Center for Girls, we provide prevention and early intervention and wraparound social services to middle and high school age girls that are at risk of systems involvement. So many of our girls struggle with circumstances that are largely outside of their control. Some have family instability, some struggle with trauma, some physical health challenges, mental health challenges, and when those go unaddressed, it often results in sometimes behavioral challenges and academic challenges. PACE focuses on addressing the underlying risk factors that our girls face and providing them with counseling, therapy, and coping skills and life skills. We work with not only the girls, but also work with the girls' families to ensure that they have the services that they need to be successful. We are statewide in Florida, and within the last few years, so we've been able to expand here into Georgia with the REACH model that Becca's going to talk about, and also have expanded into South Carolina with the same model. We serve girls in 10 schools here in Middle Georgia, so we're in the Macon Judicial District. And again, because of the investment that you made in us last year, we expanded our services here in Georgia. And not only did we expanded our services, but we also were able to use that funding to leverage that funding and secure some private dollars as well. So in Georgia, we see girls in the schools, and we also see girls in the community, girls referred by the district attorney that are referred through our diversion and prevention program. Last session, you funded us at $250,000, and we are respectfully requesting $400,000 this session to be able to increase our staff and increase our services. So now I'm going to turn it over to Rebecca Johnson, our program manager. She manages the program that we have currently here in Georgia, to talk about her role and the work that she's doing.
Good afternoon, everyone. My name is Rebecca Richard. I have the privilege of being the program manager for the PACE Center for Girls in Macon. I oversee a team of 4 counselors, and we've served well over 100 girls ever since coming to Georgia. Like Jody said, 10 schools. We receive referrals from school administrators, Department of Juvenile Justice, and we also have a partnership with the district attorney's office in the judicial district. 98% of our girls come to PACE reported with behavioral issues and risk factors. 81% have problems at school. 75% have an issue with health or substance abuse, and 98% report family instability in their lives. Our outcomes are staggeringly glorious, and 92% of our girls report improved relationships with their peers and families. And we're finding that girls are referring other girls because they see the benefit in what we do. And it's normalizing the conversation around mental health and mental wellness. And I'd love to turn it over to Denasia Johnson, our current PACE girl, who's going to speak about her experience as a PACE girl her senior year.
Hello, everyone. Okay. Hello, everyone. My name is Denasia Johnson, and I just wanted to let everyone know how PACE has helped me. I feel like it is an amazing program, and I think every girl should experience it, no matter the background. I had troubles at school and at home with my mom before I became a PACE girl. I was getting into fights at home with my mom and my peers. And the last time I got into an incident, it led me to be placed on probation, and I got sent to PACE in November of 2021. After a couple months of PACE, my life changed for the better. I got off of probation and wasn't in any more trouble, and now I'm doing bigger and better things. I am currently employed at Walmart, and I am an AB Honor Roll student this year. I will be graduating in May and attending Central Georgia Tech to be an ultrasound tech. The biggest thing that PACE has helped me with is my coping skills. I've learned that I don't need to prove anything to anyone, and everything does not deserve a reaction. It is amazing how calm and content I am because someone is here for me, and I know someone is listening, and my someone is Miss Stanley, and I'm forever grateful for her, and she's helped me so much. Ever since I've met her, she's brought me so much joy to my life. She shows me why I should keep going and never give up. Your life is what you make it, and make it great.
Thank you so much for your time today. Do you have any questions for us?
No, thank you so much for sharing your story, too. You did such a good job. I know that takes a lot of courage. We're just really regular people up here, but when you step into this space, I know it can feel a little bit intimidating. You did great. Thank you. Keep telling it, okay? Keep telling others, because that's so important. Thank you all so much for the work you're doing. I'm glad we were able to impact it. Sure.
Thank you.
Okay, next, Melanie McNeil, Ombudsman.
Good afternoon, Madam Chairman, members of the committee. I'm Melanie McNeil. I'm the State Long-Term Care Ombudsman. We're advocates for residents who live in long-term care facilities, nursing homes, personal care homes, assisted living facilities, community living arrangements, and intermediate care facilities for individuals with intellectual disabilities. I'm here today asking for a $590,000 appropriation, and you might think that seems like an odd number, but if you turn over the handout you have, you can see how we have broken out what the request is. So I'm a state employee, but the ombudsman representatives who do the work in the field, who visit with residents, are not state employees. So I'm really grateful for the salary increase and the COLA this year, but our ombudsman representatives don't get that because they're not state employees. We have about 40 ombudsman representatives. Since the pandemic, we've turned over more than 50% of our ombudsman representatives. And the work that our ombudsman representatives do is building relationships with residents so that they will then tell us when they have issues. And sometimes the problems are things like, my laundry got lost. Well, we can help with that. Or I don't like the meals they serve, or they're not serving me the right meals, so we can help them with that. But they also sometimes tell us their caregivers hurt them, or or my family is taking my money, and I know I'm going to be evicted from the nursing home because they're not paying my cost share. So we're there to try and help residents resolve those concerns. So it was a sort of stark contrast to me to see what GVRA pays their folks versus our ombudsman representatives. Many of them make high 30s, low $40,000. Many of them don't have benefits, they don't have insurance, they don't have 401k, they don't have some of the other things that, as a state employee, I'm really grateful for. They might get a stipend, but what we're requesting is funds so that our ombudsman representatives could get a $10,000 salary increase, that's the $400,000, $30,000 of additional expenses. So our ombudsman representatives are required to visit the facilities across the state once a quarter. So just to let you know, the difference between federal fiscal year 2021, we had 86,955 beds in Georgia. At the end of September this year, we had 88,379. That's an increase of over 1,400 beds. Now, they're not all filled all the time, but our ombudsman representatives are required to go and visit all the facilities and to meet with residents as they can while they're there. Each program is required to do an audit. Each program is required to have a certain amount of insurance. Those costs are expensive, and it takes away from trying to serve the residents. and we're asking for $1,000 just to be able to provide a benefit to each of our ombudsman representatives. So that makes up the $590,000. You might think, well, why didn't I just ask for $600,000 or more? But I thought, I want to be able to explain to you why we need the money that we do. And part of what we do helps the state, because with the ombudsman program, if we can resolve a problem for a resident, that means that our sister agency, the Department of Community Health, doesn't have to go out and respond to complaints because we've been able to take care of them. And it helps providers because the provider might be on the road to getting into trouble, but if they can fix what the issue is, then we're not going to call the regulators. The regulators aren't going to come out and fine them or close them down or whatever because they haven't met the regulatory requirements. So it's a pretty good program. We don't collect fees. We don't have any other way of generating income. I know that was a question. And where you would put this in the budget is in the DHS budget at line 28.7. That's the Elder Abuse Investigations and Prevention part of the budget. So it would just be really great to see $590,000 added to the budget right there, if you could do it for us. Thank you.
Thank you, and thank you for advocating for those who are in the field doing that work and being very busy at it. Are there any questions or comments from the members of the committee? I'm not seeing any. Thank you, too, for you've given us some great information, so just what we need. If we have any questions, we will be back in touch. I want to jump just a little bit here and ask Shelley Simmons to come forward. And Shelley, we can, if you want to just come to where there's a microphone on one of the desks, we can plug it on there and help you do that, whichever one you want to go to. You are always so faithful and so patient, and I don't want you to sit back there for a long time. That one? Or is it one more back? 1, 2. Is she doing the third one or the second one? I can't tell.
Good afternoon, Madam Dempsey, and to the subcommittee members. I appreciate you taking the time to hear what I have to say. My name is Shelley Simmons. I am the Executive Director for the Statewide Independent Living Council. First of all, I want to thank you for your continued support over the years with our center expansion. In 2018, the legislature allocated funding for the expansion of centers for independent living in Southwest Georgia, and again in 2019 in Southeast Georgia. The CILs worked diligently, utilizing the allocated funds in the cities of Valdosta and Screven. After a 4-year pause, the Independent Living Network would like to continue with the expansion efforts to help address the needs of individuals with disabilities throughout the state. Currently, there are 27 counties that are not currently being served by a center for independent living. CILs are hubs of disability information, resources, services, and advocacy. CILs have a unique ability to creatively address barriers within their individual communities, allowing the CIL network to respond quickly and effectively in times of crisis and emergency. Investing in CILs benefits their entire community and yields a strong return for taxpayers. Continuing center expansion will reach the unserved and underserved in our state, especially in rural Georgia. Our hope is existing funding continue and increase to expand our reach. Center expansion is of vital importance to the disability community, and our desire is to restart the drive previously set to have complete state coverage by a Center for Independent Living. State funding of $750,000 will help establish 3 satellite offices and resources expand outreach to 16 counties. If you look on the maps that were provided, you can see the areas that we would like to fill with the light blue area. Satellite offices will begin in Carroll County. The light blue will be on the right side of the page. And then you can see there Middle Georgia. Also will be 13 counties that we would like to expand. We did a needs assessment, and last year, as we were preparing for our state plan for independent living, and 96% of those surveyed stated a Center for Independent Living would be a valuable commodity in their communities. 94% of those surveyed would contact the Center for Independent Living, and 75% of those surveyed are aware of individuals not receiving needed services. So once again, we hope that that investment you will consider again. We're very close, and we also would like to continue with the momentum that was established in 2018. And on a separate note, what the Statewide Independent Living Council separately would like, we are advocating for $50,000 for a housing policy coordinator. And that will help us implement our state plan for independent living. That information is also in your packet. But if you have any questions, I would like to take those now for you.
Thank you so much. Are there any questions? Or, oops, they cut me down a little bit here. Are there any, too much? Any questions or comments from any of the members of the committee?
Thank you so much.
Thank you, and thank you for this great information. It should be just what we need, Shelley.
Thank you so much.
Keep doing good things. Okay, so next, Nancy Petra with the Alzheimer's Association.
Did I get that? Okay. Thank you. Sorry about that. Good afternoon, Madam Chair and members of the committee. I am Nancy Petra, and my slides are going forward. Hold on. Okay. I am Nancy Petra, Director of Government Affairs for the Georgia chapter of the Alzheimer's Association, and I'm here today to ask for your favorable consideration for additional investments in the fiscal year 24 budget in the non-Medicaid HCBS, including Alzheimer's and dementia respite care specifically. The impact of Alzheimer's disease continues to spiral. Alzheimer's kills more people than breast cancer and prostate cancer combined. It is the 5th leading cause of death for people 65 and older, and the 7th leading cause of death for all adults. In 2020, there were 150,000 Georgians 65 and older diagnosed with Alzheimer's disease. That number is expected to increase about 27% within the next year and a half by 2025. And that is just Alzheimer's diagnosis only. It does not include all the other types of dementia, vascular dementia, Lewy body dementia, frontal temporal dementia, and any of the younger onsets of this disease. Family caregivers bear the brunt of caring for their loved ones with Alzheimer's and dementia. And of the total lifetime cost of caring for someone with Alzheimer's or dementia, 70% of that is shouldered by families, either through out-of-pocket health and long-term care expenses or from the value of the unpaid care that you see here on the screen, leaving most of these families to spend down their income and their savings. This disease outlives a lot of our resources. Compared with caregivers of people without dementia, twice as many caregivers of those with dementia indicate substantial emotional, financial, and physical difficulties. They have depression, they have their own chronic health conditions to control, they're working, and so the burden of taking care of their loved one is significant. And while most people with Alzheimer's or another dementia are eligible for Medicare, Medicare does not cover support services like the ones you see on the screen that are provided through home and community-based service programs. Let's see. The top reason caregivers provide these services is to allow their loved one to stay at home. Home and community-based service programs provide a tremendous safety net to caregivers. Services like in-home care, adult day care, respite care, and home-delivered meals are essential to keep a person with dementia in their home longer and delay the cost of long-term care options. Delaying entrance into a Medicaid bed in long-term care, even a few months, provides great savings to our state's budget, as you heard Dr. Mims explain earlier when she talked about this need for all of the individuals that want to live at home. So in closing today, I'm here to ask the committee to consider the additional investment that you heard from Dr. Mims. We're a proud partner of the Georgia Council on Aging through COAGE, and so we are here to support the additional investment of $10 million for home and community-based services. We are also asking for an increase in Alzheimer's-specific funding that is in the Elder Community Living Services budget. Right now, there's roughly a little over $2.3 million that's been in the budget for a long time. We're very grateful. That helps to prioritize those caregivers for respite care, but there hasn't been an increase in over 10 years to that funding, so we're asking for an additional $1 million so that those caregivers that are keeping these individuals at home can continue to be prioritized and not go onto the wait lists and can have these services. We also believe this funding will help to support the newly funded Dementia Care Specialist Program, and we are so grateful for that investment in the fiscal year 23 budget. The goals of the Dementia Care Specialist Program include increasing availability of dementia-specific services and improving consumer access to the needed services like respite. So we believe this investment of additional $1 million specifically for Alzheimer's and dementia caregivers will help to ensure the success of that program. Thank you for the opportunity to tell you about this need, and I'm happy to take any questions at this time.
Thank you so much. Okay, can we get you to this microphone right there? Can we get you? Let's see if we can.
Thank you. I've had the unfortunate situation for dealing with this with my grandmother many years ago. You know, bathing as a young guy, you bathe your grandmother, you take care of her. My aunt, watching, my mother-in-law start this process. But with $1 million extra, how many people is that roughly going to bring into the system?
Sure. So the cost of the services varies depending on how many hours they need and what types of services they request. So if someone wants one day at an adult daycare, that might be $55 a day. And so it depends on, it varies depending on the cost of the service, the number of services that are required or requested from the caregivers, because it can be anywhere from 3 hours a week to 40 hours a week. As Dr. Mims says, for a lot of caregivers, they're looking for roughly 20 hours a week. So it kind of varies. I mean, so it's hard to give a rough number of how many more people, caregivers for Alzheimer's, would be prioritized at the top of the lists. But I can get you some additional numbers. I can do some math for you. I mean, I think if you took everything equal and said that every caregiver that came in was looking for 10 hours a week at, let's say, roughly $25 was the cost, because these are individuals who are below 300% of the federal poverty level, but they're above the Medicaid level, and there's a cost share. So they're, depending on where their income is, a lot of times they're paying a part of the service. But just rough numbers, Representative Donahue, if you took it all equal, completely equal, and everyone wanted 10 hours a week at roughly, I think, $25 an hour, I mean, that's like another 70 people that are prioritized at the top of the list for HCBS caregiver services.
And we're not looking like 24/7 care.
No.
Some that we have to do.
Right.
So with this, we're looking at 3 hours to 5 hours. It's pretty much going to cover 7 days a week, 5 days a week.
A lot of times it's 5 days a week. It depends on the caregiver need. But so for someone who's a working caregiver who just needs to have that time during the week, maybe to concentrate on work for a few hours, it might be 3 to 4 or 5 hours in an adult daycare, or someone coming into the home to do social activities, do that dressing, do that bathing, feeding them, so that they can step aside, go to the doctor, work, take care of their own children. A lot of these caregivers are in that sandwich generation, like myself, where you're the primary caregiver for your parent, but you're also raising children. So, yes, absolutely. Thank you.
Thank you. Are there any other questions from the committee? Well, please note how much we appreciate the work you're doing, Nancy, and for this factual information. This will help us.
Thank you so much.
A lot. Thank you. Thank you. And next we have Thay Ramirez with an exciting something that this was new to me also. I've just learned about this in the past month or so. Let's see if we
Do what? Oh.
And you could just pick recommended settings.
Do we think it'll work, Amber? Sorry.
No, that's all right.
It's this piece, sorry.
No problem.
If it doesn't work, that's fine.
Is it on like YouTube or something, perchance?
It's on Facebook.
Okay.
That's fine.
Okay.
It doesn't work. All right. Good afternoon, Chairwoman Dempsey. I'm Thea Ramirez. I'm the founder and CEO of Adoption Share, which is a Georgia-based nonprofit organization. I drove up from Brunswick, Georgia, yesterday evening. I'm here today to talk about our Family Match program. It's an adoption matching tool used to help children who are legally freed for adoption and do not have an identified family already in the wings. And it helps uses data and compatibility matching to better match more efficiently and appropriately on markers of compatibility these kids that are waiting. I had a story of one of our successful adoptions that took place over the past 12 months when we conducted a pilot with the Division of Family and Children's Services. And if I could play it for you today, it's a quick clip, but it talks about a predicament that faces many of our families here in the state of Georgia, who oftentimes are finding themselves with a call in their life to pursue adoption through foster care.
and are waiting years to adopt children that are waiting to be adopted. In fact, waiting longer. This in particular story, and I'll make sure everybody on the committee gets the link so you can watch it, had been waiting actually the same amount of time as the child that he ended up adopting. He had been waiting about 3 years and had been utilizing the state's primary resource for making those connections, which is a website that features waiting children, where families can go and look at children that are legally freed and available for adoption, and then make inquiries in that process. And after waiting about 3 years, his caseworker told him about Family Match, and we had just started piloting in the state of Georgia, and he was matched with his son in 2 weeks of just being on the tool. His son had also been waiting for an adoptive family for about the same amount of time, about 3 years. And so, members of the committee, what I'd like to inform you about today is really just something that should give us pause of good news, that we actually have families that are waiting to adopt these very children from our foster care system. Kids that are older, kids that have significant special needs, behavioral health needs, medical need, cognitive, developmental. We have families that are waiting to adopt these children, and that the issue that our nonprofit is solving is one of connection. It's not a scarcity issue, as in we lack these families. It's our systems of care today are lacking appropriate resources that can really help make those connections happen in a more timely and appropriate manner. So the handout that you have before you today just briefly talks about the situation here in the state. We have on any given day around 1,800 of these children who would otherwise be legal orphans in that they have their parental rights have been terminated but have not yet been adopted. And on average, about 300 is what the state estimates are the number of kids that don't have any family identified. It's important to note that most of our kids and Georgia has done a fantastic job in the past about 5 years or so, increasing the number of adoptions among foster parent placements and relatives. So that's kinship placements, which is fantastic. The kids that we're speaking about and the kids that we serve on our Family Match program, on our Family Match application, are children who are legally freed and have no family identified. And so those are the kids that we're helping. And we know all too often that the children here in the state of Georgia, I think Georgia ranks 50th with having the most amount of kids that wait the longest. So it's about 17% according to Kids Counts, which is part of Annie Casey Foundation, looking at the number of kids that are still waiting 5 years plus after having been legally freed. So it's an issue, and then that second paragraph really touches on the issue is solvable. Harvard and the Urban Institute did a study about a decade ago or more that showed about 240,000 families every year will call their local child welfare agency wanting information on how to adopt children from foster care. And so we believe that using data and using compatibility matching through computational models is a really scalable, efficient way. Our goal is to equip every worker in the state of Georgia with an opportunity to utilize this tool for children that they are trying to find families for. So it tells you a little bit about our program and the handouts that I've given you. Just a quick run. The way that our tool is different is that on Family Match, we do not showcase pictures of kids. We don't solicit waiting children to waiting families. All of our children, in fact, we started a statewide pilot in the state of Florida a number of years ago, and to date we've matched almost 900 kids without the single use of a photograph. We're equipping the workers and inversing the outreach, allowing workers to contact families on the markers of compatibility and relational fit. We want these matches to last a lifetime. We also centralize all of this information in one place. Over the course of our 12-month pilot, we actually grew the state's own pool of waiting families to about 275. When we started, it was 0. And these are families all over our state. 50% of them, over 50% of them, are looking for older teens. So incredibly encouraging that we actually have resources right here in the state, but for technology that can help us make those connections happen faster. I talk a little bit about centralizing that information for workers to be able to see where these families are from anywhere across the state. And lastly, we're using that relational fit score score based on research done by former senior researchers at eHarmony that looked at any individual attribute in association with the success or failure of a foster or adoptive placement. And the benefit of our program is that we can track these matches as they materialize into placements, and placements as they materialize even into post-adoptions. And we continue to track the quality of these relationships and the stability on an ongoing basis so that we can leverage the learnings of that algorithm and those outcomes of that computational model to make further improvements to the system. So we are humbly requesting the opportunity after a successful pilot run where we matched 26.9% of all the children that were enrolled in our program over that past 12 months, which was an incredible feat to do here in partnership with Division of Family and Children's Services. That average time, by the way, to match was about 2.3 months, which is a savings of up to 4.5 years when you think about how long kids have been waiting. So we're here to humbly request a $250,000 appropriations request to help sustain our work as we continue to scale and expand our work statewide. Thank you so much.
Are there any questions from the committee about this matching program?
Yes, ma'am, and I apologize. Let me ask you, basically, these families, you say most of them have nobody. They came here. Does that mean they have no grandparents, or they basically their mom is prison or drugs or something like that? And I don't want to assume that's why I'm asking.
Yes, sir. Typically, kids that by the time they get to our program, the extensive search for relatives has been exhausted. There are none that are either willing or capable from the state's perspective, and that the current foster parent is not able to continue serving the child in that capacity of an adoptive parent. And so these are kids, a lot of them, like in our work in Florida, about 49% of our adoptions are coming from kids that have been spending time in residential treatment facilities, congregate care homes. So you think about making room for other kids that need those places. Instead of warehousing our children, we can actually put them in families, and that's our goal.
And 250,000 will bring how many children to, basically, if we're looking at a number, a few hundred, 1,000?
Yeah, that's a great question. So our goal would be to continue expanding the tool statewide to serve all 300 of those kids. We'd like to see utilized and be onboarded onto the application, and within probably a year's range, we would look to at least have celebrated 20-25% of those kids. There's a rolling timeline of when placements can occur, and then children here in Georgia have 6 months of placement before they're eligible for the adoption finalization. So there's a little bit of a rolling work, but yeah, the goal is, with your blessing and your support, we can do more to add to the incoming fuel pipeline of families coming in, and do a better job getting more children onboarded onto the system so that they can be matched and adopted.
Thank you.
Yes, thank you.
Could you provide us, thank you, could you provide us with, not right now, but maybe send us something in writing, what the history of your program is in Florida? Has
Absolutely.
Florida funded that? How long has it gone on? Yeah. How much state support? And how are you funded now in Georgia?
Yeah, great question. So we rely heavily on philanthropic support and contributions. We were supported by a foundation down in Florida privately for the past 4.5 years to sustain our work at no cost to child caseworkers and things like that. Our work here is continued by the generous support of our donors. We would like to continue expanding and bringing our tool to new states. Currently, we operate in Florida, Georgia, and Virginia, where we work directly with the Virginia Department of Social Services and have a contract there.
If you could just give us a one-pager, what is the state support, if any, in Florida, or state support, if any, in Virginia?
Got it.
Thank you.
Yep.
Any other questions or comments from the committee? Not seeing any. Safe travels, and thank you for coming. God, thank you. Okay. So next, Jennifer King with Georgia CASA.
Good afternoon, Madam Chair and members of the committee. I'm Jennifer King, Executive Director with Georgia CASA. I'll briefly share our budget request for FY 2024 that's outlined on your flyers. First, though, I'd like to thank the committee and all the members of the General Assembly for the ongoing commitment to CASA advocacy across the state. This year marks 35 years of CASA advocacy in Georgia, as well as the year that CASA will be active in all 159 counties, with Henry County coming on this spring. This milestone is shared in large part with this body and its significant investment in geographic expansion. With CASA present in every county, we are able to concentrate on expanding CASA service capacity to provide volunteer advocates for all children in defects custody. We are embarking on a multi-year strategy that targets areas with the largest numbers of children without a CASA advocate, 3,000 in total. When we reach this goal, CASA will be going from serving 55% to 75% of all children in foster care. To help get there, Georgia CASA seeks to increase our current state allocation by $2.7 million over the next several years. $2 million would support adding staff in critical needs areas. Specifically, 7 jurisdictions serving 28 counties are targeted, areas that experience some of the highest rates of foster care entries in the state. Combined, these areas have nearly 5,000 children, or 30% of the total foster care population, and individually, each CASA service area exceeds 300 children without a CASA volunteer. When we met with Commissioner Brose and her team in August, we agreed that these areas are of joint focus and will greatly benefit by increased CASA coverage. Building off previous success in seeking a similar targeted investment for Fulton and DeKalb counties in 2015 and 2016, and knowing that state funding supports CASA by providing 1 staff to supervise 25 to 30 volunteers, this increased funding would cover 40 new paid positions to support an additional 1,000 volunteers. 7,500 would be to sustain growth and expand service across the remaining 38 affiliates. Without additional state funding, increases in service areas and performance in response to heightened demand and volunteer availability are unable to be recognized with higher allocation awards, which places a burden on local affiliates to increase outside funding while simultaneously maintaining heightened service levels. These additional funds would allow us to continue to provide coordinated training, statewide recruitment, screening, and quality assurance efforts. In closing, we lift up that we are proud of our exemplary public-private partnership with the General Assembly, providing 21% of the total CASA network's annual budget. We leverage the state's $3.885 million investment to the CASA network's total current operating budget of approximately $18 million, and will continue to do so to support this and any future state funding requests. Thank you so much for your time and consideration.
Thank you. Representative Saines.
Thank you. Thank you. I appreciate you noting the state funding is 21% of the total affiliate. How many affiliates are there in total? It's not per county, correct?
Correct. We're primarily set up by judicial circuit, so we have 45 affiliates across the state.
And how is that funding out? Is the grant funding from the state allocated per county to the affiliate serving that county, or?
Mm-hmm. We have a statewide allocation formula. It's based on, there's a base funding for each judicial circuit. And then we also take into account the number of children in foster care. And then we look at what percentage that CASA program is serving. So in your particular area, it's 1 judicial circuit, those 5 counties. And their award is probably their award is $120,000.
Thank you. That you do a lot with a little bit in terms of leverage. The last question, if the Madam Chair is okay, the 92% without a CASA in Gwinnett, that seems higher than anywhere else. Is there a rationality there? Or?
Yeah, so Cobb and Gwinnett are similar in some ways, is that they are both administered and operated under the county, and so it's county funds with some of the state funds that are put together. Both those, the county and judicial leadership, are in support of expanding those programs with additional state funding staffing, and we hope that we'll be able to help match that. The community is kind of ready, and they likely have a waiting list of people who want to volunteer, but not the staff capacity to do so.
So are they the only affiliates that are county managed in terms of the model?
Clayton, Cobb, Gwinnett, and the Appalachian Judicial Circuit are the 4 CASA programs that remain as county administered programs.
Okay, thank you.
Representative Cameron.
Yeah, thank you. I met with the CASA volunteers last week when they were down here. Then I went to the CASA office in Lafayette, Georgia. I'm in the Lookout Mountain area, Lookout Mountain Judicial District, and the work you're doing is great. I'm amazed at what they can do with just the smallest staff as they have, because the need just continues to grow. Thank you.
Yeah.
Thank you. Are there any other questions or comments from the committee? If not, I have one. So what is the exact amount that you need for this year, for the 24 budget?
For this year, so we think it might take us 3 to 4 years to get up to the $2.75 million. So we're, if it's $750 or $1 million, that would be a great starting point to start to invest in those staffing positions, as well as the capacity of the additional affiliates.
Okay, great. So about a third is what you're thinking of, yeah. Okay. Okay. I don't see any other questions. Thank you for the work that y'all do. We know it's important throughout the whole state.
Thank you so much.
Good afternoon, members of the committee. Thank you for hearing my testimony. My name is Wayne Sleer. I live in Gwinnett County. I have a little closer. Is that better? Okay, I'm sorry. My name is Wayne Sleer. I have a 21-year-old autistic child that will age out of the Gwinnett County Public Schools in May. To keep my son safe at home, we have locks on multiple rooms in our house. We have cameras inside and outside of the house, as well as sensors that tell us when somebody leaves. In many ways, our house resembles a prison. While I have been here, my son tried to make hot chocolate by pouring milk into the coffee maker. We don't know if the coffee maker made it or not yet. He also decided to discard several items in the kitchen, which he thought we didn't need. We have been able to keep him safe because he has been in school and I have worked remotely. With school ending and me going back to the office, the future is very uncertain. We completed the interview for the Now Comp waiver last month. With a wait list of 7,000, we have little hope to qualify for one. The future is very bleak. I would encourage the committee to fund the 2,400 additional waivers this year. I think it's part of a 3-year plan to eliminate that 7,000 wait list that currently exists for the Now Comp waiver. Thank you.
Thank you. Are there any questions or comments from the committee? So let me make sure I understood. You said you applied for a Now or a Comp waiver? Which one?
I think it was Comp waiver.
Comp, and you applied when?
We applied last month.
Last month, okay. Have you received any
notification? No. It takes a couple weeks.
No.
But I was told that with the wait list so long, I would probably end up getting on the wait list, but the chances of, actually getting the waiver would be slim.
Okay. Well, thank you for sharing your story.
Okay.
I hope your son and your home both are okay when you return.
Yes. Thank you.
Thank you. Next is Sally Buchanan with Together Georgia.
Good afternoon, Madam Chairman and members of the subcommittee. I'm here again in front of some of you that I was in front of yesterday, but I'm also here on behalf of the providers for Together Georgia. I am the CEO of Creative Community Services and also serve as the chair of Together Georgia. I wanted to discuss about our providers. Across Georgia, our providers serve thousands of DFACS youth each year, and our funding comes through the Department of Human Services out-of-home care program. And the funding previously provided by the General Assembly and the governor for the rate increase was absolutely a positive step, and we're very grateful for that, and I can't go amiss without saying that. So the funds were able to provide and improve our rates. However, our providers remain underwater with cost. The increase, they had assisted, but it didn't provide the coverage of the costs that we're now incurring. The rates paid were based on DFAC's own study of rates done in 2016, so we're definitely way behind. Unfortunately, we remain challenged, and our providers like you and many other Georgia businesses struggle to make ends meet with the rising inflation, the increasing costs for normal goods and services, and also, as we've addressed in several committee meetings, and I'm sure you've heard, the locating of appropriate workforce and the payment of the fees for appropriate workforce. Many of the Together Georgia providers have worked tirelessly to help Georgia address the hoteling problem, as we've talked to Commissioner Broach about, and DFACS has worked with us increasing the rates to serve these youth who often require added staffing and to assure not only their safety, but also the safety of the others that are in their care, or in our care, sorry. Many of these children that have high-end needs have caused a lot of damage to our facilities and also to our homes, and the costs are not covered by the state, even though those children are placed through the state and in our care. I'm here today asking for consideration of the following. We'd like to make permanent the increased rates that are paid to the providers that are admitting hoteled youth. We want to create a grant program to assist providers with recruitment, retention, and training of staff, as well as the funds to reimburse for damages that are caused by the children. You heard from Commissioner Broach about, the hotels and their damages, the facilities and the group homes, cottages and foster homes have also incurred a lot of damages. We have, in my agency alone, one child costs $4,000 to a foster home. We have another agency where the cottage incurred $28,000 from several children that they served. Finally, we'd ask that the provider rates be reviewed, possibly through a study committee that would be established to take an in-depth look at the current environment. Thank you for letting me share this, and are there any questions?
Thank you so much. Are there any questions or comments from the committee at this time?
Great, thank you so much.
Not saying thank you for the work you do. I know some of us have toured a number of your facilities, and we'll probably want to do that again.
Absolutely, and I invite you to come to some of the foster homes too, because of course they're not facilities, but our foster parents are pretty amazing.
That would be great. Thank you so much. Okay, so last but not least, thank you for your patience. Carson Pennington, reach out and read.
Good afternoon. Thank you so much, Madam Chair, and the entire committee for giving me just a moment of your time today to speak about a topic that's incredibly important to me and that I hope is also important to the state of Georgia. Just to introduce myself, my name is Carson Pennington. You looking at me might see a confident young woman, someone who has the ability to testify in front of you on a topic she's passionate about. But 22 years ago, I was a 3-year-old child that developed a stutter out of nowhere. I was talking perfectly fine one day, and the next, I couldn't get words out of my mouth. I had no confidence to finish the sentences that I started, and my parents began to panic. And like most parents do, they went to their most trusted source, the pediatrician. Immediately, my pediatrician recommended that my parents teach me to read, which sounds absurd for a 3-year-old, but it was something that I picked up quickly. I haven't put down books since. I have an entire library in my apartment, and it's my favorite pastime to this day. So to say that reading changed my life is not an understatement. It's not an overstatement. It is entirely accurate in the fact that I wouldn't be standing here in front of you today as confident a public speaker as I am without words and without literacy and without that opportunity to change my life because of my pediatrician. In the last year and a half, I've traveled close to 40,000 miles across the state of Georgia in my capacity as having been selected Miss Georgia 2021 and having competed at the Miss America competition. I selected Reach Out and Read as my social impact initiative, my community service platform. And through it, I have had the opportunity to interact with pediatricians across the state, to get to see them interact with children, to watch children pick out books off of an entire wall and get to take home as many as they'd like often, because pediatricians just simply can't tell them no when they want to take home more than one. So in my role as Miss Georgia last year, and in my capacity and having selected Reach Out and Read Georgia, I came to know this incredible nonprofit as something that I think not only deserves a lot of attention, but that demands it as a public health intervention today. I currently serve as the communications specialist for Reach Out and Read Georgia, and I'm here today on behalf of our executive director, Amy Erickson. At Reach Out and Read, we give young children a foundation for success by incorporating books into pediatric care and encouraging families to read aloud together. We partner with pediatricians across the country and right here in Georgia that have a mission to reach the underserved, provide services to children from low-income communities, and stand to benefit most powerfully from a pediatric literacy intervention. We work with children from birth through 5 years of age and their families. At regular well-child visits for children up to age 5, Reach Out and Read trained pediatricians deliver books and literacy guidance as a standard of care. Starting at birth, the provider enters the exam room with a new developmentally and culturally appropriate children's book and hands the book to the child. They use the book to assess the child's developmental progress, assess the parent-child relationship, model age-appropriate interactive read-aloud techniques, and foreshadow upcoming developmental milestones. The provider then gives the book to the child to take home and keep. With this model in place, by age 5, children have a home library of up to 15 books. During the visit, the provider educates parents on the importance of reading aloud. Parents learn that reading aloud is the single most important action they can take to help their child's health, cognitive, social, and emotional development and start school ready to learn and even overcome temporary disabilities like the one that I had when I was 3 years old. Because we embed our program in the pre-existing medical system, our model is powerful, cost-effective, and scalable. When pediatric providers deliver our model with high fidelity, children and families can realize the powerful outcomes shown in our evidence base. In fact, 25 studies speak to the effectiveness of the Reach Out and Read program. Through Reach Out and Read, we support families and their young children through a public health framework that offers universal and individualized promotion of safe, stable, nurturing relationships as a standard of care in and out of the well visit. Our infrastructure and scale allow us to create bridges between sectors and reinforce support for foundational relationships within the pediatric healthcare system and more broadly across the spectrum of early childhood interventions. Reach Out and Read seeks to give all children an opportunity to reach their full potential. We strive to reduce the opportunity gap, to create a world where family income, race, and geography are no longer predictors of academic and life success, which is why we offer books in over 28 languages just in the state of Georgia. We envision a world where all parents have daily, positive, meaningful, language-rich interactions with their child as close, loving relationships support a child's ability to thrive. Scientific evidence increasingly demonstrates the significant impact that a child's early relationships with their caregivers have on all aspects of their cognitive and social emotional development and future well-being, and that positive, language-rich parent-child interactions provide the foundation for future health, academic, social, and economic success. To realize these goals, we maximize the potential of pediatric primary care to promote positive interactions that foster healthy child development during the critical early years of a child's life, birth through age 5, when the brain develops more rapidly than at any other time in our lives. We partner with pediatric offices and clinics that serve under-resourced households and incorporate books and storytelling into primary care, which strengthens the parent-child relationships that are foundational for healthy early childhood development while addressing the social determinants of health. We serve families with children between birth and 5 years in arguably the most critical years of life, with a focus on partnering with clinics serving high Medicaid populations. We reach approximately 1 in 4 children in poverty across the country. Last year, we served 4.5 million children and families through a network of 33,000 medical providers at 6,100 clinics in all 50 states. In Georgia, we serve over 150,000 children and families in 175 pediatric offices and clinics in 62 counties in Georgia. We believe that every child in every county in Georgia deserves to have the benefit of the Reach Out and Read intervention. We are also serving every military child 5 years and younger on every single military base in the state of Georgia. There's no better investment than the investment you have before you. This opportunity is here and now, and so it is our honor to ask for your support in helping to sustain and scale Reach Out and Read across the state by way of an investment in our children. The cost to implement a high-quality Reach Out and Read program is approximately $20 per child. Our ask is to be awarded funding in the amount of $500,000 to $1 million to support our early education intervention to reach between 25,000 and 50,000 children and families. This investment would provide on-the-ground programmatic support in support of the program, which includes a new children's book at every single well visit checkup. Thank you so much for your time today and for giving me the opportunity to explain why literacy is important to me personally, but also to the development of Georgia's children. And at this time, I would love to offer up time for any questions that you might have for me.
Wonderful. Representative Saines.
Thank you, Madam Chair. So just to be clear, Reach Out and Read currently receives no state funding?
That's correct, I believe.
Okay.
Jason would know better than me here.
And then so no further questions, but I do appreciate your testimony that it sounds like a great program.
Thank you. Thank you.
Where is the funding that you currently have right now?
We fundraise. We fundraise as much as we can. We host digital book drives, which can prove to be successful. We're the state community partnership with the Miss Georgia Scholarship Organization, and in the past 2 years, that organization has raised close to $20,000 for Reach Out and Read alone, just again, through the virtual book drives and through creative fundraising in their communities. And we've employed these local title holders to really reach out to the pediatricians' offices that are part of the program, offer to see how it works, help be the ones to give the books to the children, give them that opportunity to choose. So yeah, we fundraise internally.
Okay. Are there any other questions from the committee or comments? Well, I am familiar with the program. I have visited with a pediatrician who was giving out books a few years ago. It is a strong, positive program, not only to sort of, I would say, bring together reasons to incentivize those wellness checks and staying up to date on things that are so important, but also that 0 to 5 brain development.
Right.
So thank you for picking that as your champion. So
it was an easy choice, a very easy choice.
Thank you. It really was. I appreciate you coming to see us today.
Thank you so much for your time.
So I don't believe we have anyone else that has signed up to speak. Have we heard from everyone that's here? Some of you are so loyal and patient and listening to everything that we do up here. We appreciate it so much. There being no further business, the committee is adjourned.